Hi, my name's Prew. I'm a physio. I've been a physio for 30 years, and through that time I've seen a lot of backs, and I've seen a lot of people who don't understand what the hell they're trying to do. I've had my own back pain, so it's a special interest to me, and I've learned how to deal with my own, and I think I can help you learn to deal with yours. I'm going to talk about McKenzie and how a chance finding on his part led us back to the disc being the diagnosis. We'd been thrown off that by an English anatomy professor who said there are no nerves at the back of the disc. I'm going to talk about Nakumson, and he did some pressure studies. He was lucky enough to have young people from Scandinavia agree to have a pressure catheter inserted into their disc, and he learned things from the pressures that they sustained from different postures and doing different exercises. And that can help us to understand why postures hurt, why some exercises hurt. I'm going to go through the range of movement that you need to try and get back and how important that is, and also some exercises and some postural stuff to make you aware of what you're doing. Posture is so important. The first 10 things that you need to know about your back are posture. Posture, posture, posture. It's the most important thing. The most important fellow in recent times has been McKenzie. The story goes that he walked past a busy waiting room and he said, "Mr. Brown, when room number 4 becomes vacant, you should go in and lie down on your stomach." Now, it was a little later than he'd hoped, and when he came back, he found that Mr. Brown was indeed lying on his stomach. But the person before him had been sitting there getting his knee treated. And Mr. Brown was lying on his stomach with his head at the top end. And Mr. Brown said, "This is the best I've felt in months." And McKenzie said, "Good, go home and then we'll come back tomorrow and we'll do it again." Not really knowing what was happening, but obviously if it's the best in months, then that's a good thing. McKenzie continued to look into it from that point of view, and he found that if people can centralize their pain, they have a good result. Now, what does centralize mean? Well, if you think about back pain, and when it gets worse, it starts to go down your leg more. So it'll start central back pain initially, then go out into the buttock, and maybe central back pain plus down to your knee, and then maybe even down to your foot. It's worsening as it goes down to your foot. If you can make a foot pain, back pain with foot pain, come back into the middle and maybe it's only to the knee then that's an improvement. You have changed what McKenzie would call a derangement 5 or 6 into a derangement 3 or 4. And then if you can make that go into a lesser one, then good. And you're improving it. You are centralizing the pain. So let's look at the disc. I'm going to choose a lumbar disc. So that's your vertebra, and I'm going to draw just that piece there. Okay. So vertebra, vertebra, disc in the middle. Gooey center surrounded by layers of ligamentous material. So like ligaments, as in Achilles tendon, but in layers. So if you bend forward for a long time, the nuclear material tends to migrate towards the back. These would crunch up at the front, and those would stretch out at the back, and oftentimes stiff to stand up. Now, you've been told not to twist when you lift, and the reason is that the layers of fiber are like that, and that would stop you turning too far that way. And the next layer is the opposite. So if you come up straight, they are equally helping to contain the nuclear material within the disc. But if you say twisted, say you're twisting that way, those get tighter, but these get a little looser. And you can get some nuclear material going out into the back part of the disc. Now, here's your disc from above. Gooey center, spinal cord, nerve, going down your leg, especially with the low lumbar ones. Part of that nerve comes back and it supplies the back part of the disc. Now, if you've injured yourself here, it will often go to the side because there's a very strong ligament here protecting your spinal cord. So that would feel like back pain on the right. If you've injured it a few times, the next time it happens, it'll be a bit worse, and the next time it happens, it'll be a bit worse through a few more layers, and then sometimes it will actually cause it to bulge in the back part of the disc. As it bulges more, it will feel like the pain is going down your leg more. So to go back to what McKenzie was talking about, he was talking about derangements. So in his talk, that would be a derangement within the vertebra. And if it's a derangement which only has pain down to your buttock, then it's a derangement 1 or derangement 2. 3, 4 is to the knee, 5, 6 is to the floor. The 5 is if you're standing straight, the 6 is if you are tipped away to the side. The next person we're going to talk about is Nakimson. Alf Nakimson is a researcher from Scandinavia who was lucky enough to have young people agree to have a pressure catheter inserted into their third lumbar disc. So they agreed to have a pressure catheter inserted into their third lumbar disc, and then Nakimson was able to do pressure studies in different positions. He had them in different postures to show how that might affect your feelings of back pain. And he also did some studies with exercises and how some exercises actually have a huge impact and create huge pressures within the disc and are actually potentially quite dangerous. So we'll go over the studies and we'll look at them now. So now we're going to take a look at them. You can see this on the net. Okay, so with the pressure catheter inserted into their third lumbar disc, they evened them up and called the standing person 100%. If the person was lying on their side, the pressure within the disc was reduced, and lying on their back, it was reduced more. If you look at the person bending forward, they are at 150% pressure within the disc. If you bend forward and you have a weight in your hand, it's 220% of the pressure within the disc. Here is a person sitting, and they'd often say, I wasn't doing anything, I was only sitting. But the pressure is very nearly the same as that person. Now that person would say, oh, I was bending forward and the pressure came on and the pain came on. But this person is actually feeling innocent of any wrongdoing, but just actually sitting there increases the pressure to nearly as bad as that. If you slump, it's even worse, and if you slump with a weight, it's hugely more troublesome than if you're standing, and that's trouble. No wonder they're sore. If you stand, if you've been putting increased pressure within your disc and you stand up, that's why it's sore. Because of the hole at the back, allowing nuclear material out into the back part of the disc. If you've done a really nasty job of it, you'll actually get leg pain too from something like that. So as well as the studies with different postures, Nakimson did some with different exercises. Here's your 100% man, the standing person. So that's 100%. Now, this person here doing straight leg raises is already at 150%. So that person at the end, if they've got an active back problem, I should think they possibly could even be worse after that. This person here is doing a Superman, and that's 180%. This person here doing sit-ups, now if you talk to most people, they'll say, oh yes, I was doing a great job. Did 35 of those. Well, at 210%, if you've got a back pain, I think that you could be worse after that. And if you're worse, that's why. Posture is so huge. Well, I'll sometimes have people come in and they're sitting like this and they'll say, oh, I wasn't doing anything, I was only sitting. Well, take a look at that posture. Take a look at the posture of young people working their machines. It's awful. If you think about that Nakamson stuff and you think about the pressures within the disc, people are looking for trouble and it's going to come back and bite them. People are often have arm symptoms, like most people understand that if they've been lifting and they get leg symptoms, but the arm symptoms are a huge factor nowadays. People are sitting too much, they're not aware of what they should be doing in terms of neutral, and so they are vulnerable to re-injury. And if you've had a back pain, you need to treat it and then you need to maintain it. So McKenzie would say reduce the derangement and maintain the reduction. And that's what you need to think about when you're trying to look after yourself, trying to treat your own back. So we're talking some more about posture, and it's the most important thing. So you need some way to know what good posture is, and this is a handy tool. It's a broom handle I got the other day from the dollar store. So if you get your most erect, so bring your head up, imagine something holding you from the ceiling. Now you're trying to use this to help you with your posture. So it should touch in the middle of the thoracic spine, at your coccyx, and you are filling in with your knuckles the gap that you make when you're standing your most beautiful. Okay, so that's neutral. If you lean forward, you come away from neutral, and going back to that Nakamson stuff, you will notice that the pressures within the disc are much higher. Okay, so then you're going to sit down and you're going to try and maintain a neutral posture. You'll often find that as your knees go down when you're sitting, it becomes easier. Most people have okay standing posture, it's just their sitting posture which is rubbish. As you sit more, it comes further forward. Right? So thinking about the discs, thinking about the pressures within the discs, maintaining a good posture is very important. I happen to have this handy dandy thing here which you can use to strengthen for neutral. It's a garden glove full of sand or pebbles. A friend and I were trying to work out how we could make it harder and give you strength in your muscles. We were looking at various things and my wife said, here's the solution, a garden glove full of pebbles. I thought it was the most brilliant thing I'd ever heard. Okay, so here, you've decided what neutral is with the broomstick. You are now working with a perfect posture with a little bit of weight or axial compression. So if you walk around with that for a little while, you'll start to feel the muscles in between here start to get irritated. And when you do, then you can take the hat off. And you can use this as a resistance training, and you can take the time for how long it takes you to get sore initially. And then as you do that more and more, then you can use the time to establish how much stronger you are. If your job involves lots of lifting, then you need to prepare yourself for maintaining a neutral posture down to as far as you can. So you're trying to assess yourself. Initially you would do it slowly to try and establish where the problems were, so that then you can bend down correctly, bending your knees, keeping your back straight, keeping your head up, and then come up with the thing. But you're using this to establish where the problems are. Is it that you're too weak in the thighs? Is it because you're too weak in your core? And we'll go over some exercises to help you strengthen that. The core has become a big thing. It's very simple though. if you know what you're doing. I think the best way to get your core going is to put your fingers on your sides between your rib cage and your pelvis and use the muscles which you need to push it out. So like that. So laughing, or you can feel it. It's the muscles that are involved by when you're doing the weightlifting. You're trying to make your body into a tube of which your back is only part, because tubes are very strong. You're trying to maintain that, and you're trying to maintain it through a larger range of movement to maintain the stability of your body. So you can do Kegels exercises for the lower part of your core. These, the ones I just showed, for the middle part, and the upper part where you're trying to get your neck is where you need this chap. So bringing your shoulders back and keeping that on your head in a perfect posture until it starts getting sore. Then take it off and try and do more next time. So for further up your back, you're wanting to start to try and strengthen up the shoulder retractors. And they are the muscles which pull your shoulder blades together, particularly the bottom parts of them. If you can bring your shoulders back and keep doing that and strengthen those, that will help to maintain a neutral posture. And then further down or further up, and that will give you some axial compression to just give you a bit of resistance. Who's got the best posture in the whole wide world? Those people who carry stuff on their head. And if you can maintain that, and this just gives you a little bit of feedback for that, then that will help you to avoid trouble. The more you can maintain neutral, the better. Now we're going to talk about range of movement. I will often ask people when I see them to do that, and they're very stiff, and they'll say, why aren't you doing that? They'll say, I don't do it because it hurts. Well, if your elbow stopped at 20% off range, you wouldn't say, oh no, I'm leaving that till Christmas. You'd say, oi, it's not going, and you'd go to a doctor and, oh, everyone would agree, that's not good. Let's try and get that range back. But people, when you start talking about their neck, they have different rules. There aren't different rules. It's all just joints. And synovial joints have certain things about them. I'm going to draw some stuff about the knee. Here is a knee. This is the type of image you would get on an X-ray. And depending on which side, there's another little bone there. The gap is cartilage. And so there's cartilage on the end of each bone. And there's cartilage across there. And that forms the gap. Now, if you think about this, when you're young, the blood vessels go up and supply the cartilage as well as supplying the bone as you're growing. But when you mature, that seals off. And those cells within that layer of cartilage, so here, I'll draw it here. So there's the bone and there's the cartilage. So I may be drawing that piece there. Layers of cells, kind of flat cells, but layers and layers of them. Now, when the blood supply stops being supplied from within the bone, this is the joint capsule. And inside that joint capsule, the cells here are called synovial cells. And they create a fluid called synovial fluid, which supplies nutrients and oxygen to these cells. So if you imagine a sponge sitting on the bench, there's ink on the bench, and you're trying to get the ink to come up through the sponge in the same way that you would try and supply nutrients to those cells. If you just leave it there, the ink will slowly percolate up. But if you press it, then it will immediately bring it up. So the reason that you're keeping your range of movement, the reason that you're doing sort of repetitive things but not too hard, is because that's doing the best thing for those cells on the ends of your bones. So keeping your range of movement is extremely important. You can't say, I don't do that because it hurts. You need to start doing it and you need to get your range back. I talk to people about range of movement and I'm wanting them to get to a better range of movement. Oftentimes they're bending forward and they've got stretches like that, but when it comes to getting their neck back, often they don't know what they're doing. So to start, if you nod your head back and forth, you can feel that pretty much happening right at the top of your neck. If you're sitting up really straight, you can bring your neck back or your head back. And then when you look up, you can feel that sort of happening further down. If you go back further and then look up, you can feel that actually happening down into the middle of your back. Now, you must keep a good posture because if you slump, then that's just blocked up. So you need to be erect, and this is where the pole up your back, that sort of thing, you've got a neutral posture, and from the neutral posture, head about vertical, straight back, and then look up. Here's a bench. You could use, I use my bed, but for demonstration purposes. So you'd start off fairly flat, and as you go over the edge of the bed, your head foot tends to go down. So as you come out, then your head's down. You wouldn't want to be too sore when you're trying with, all right? But if you're not sore and you're wanting to stretch out, this will help you do it. And then I usually come out to where my shoulder blades are, bottom of my shoulder blades still there, and then I stretch. And sometimes I'll even stretch all the way down. That has been hugely helpful for controlling my own back pain. I do that not infrequently myself. Now we're on the floor. I want to show you some stretches for your low back, and then we'll go on and we'll stretch the thoracic spine in a slightly, well, in a different starting position. So if you're trying to get your range back into extension for your low back, then this kind of press up situation here, and then just try to relax and sag down. If you bring your hands a little bit further forward, you can change where the pressure is behind your back. As you come forward, it will feel as if it's a bit higher. In order to stretch your thoracic spine when you're down here, you can bring your elbows to here. Start by retracting and extending your neck. Put your thumbs under and then just try to relax and let that stretch through your mid-back. You can change the angle of your elbows a little bit to just make it more specific. So you've been to the doctor and you've got a diagnosis of soft tissue injury. So over the weekend you helped someone move, you twisted wrong, lifted something too heavy. Ooh. So off to the doc. Now they'll send you off for an x-ray because they want to know that it isn't broken. Okay, good. I want to know it isn't broken too. But if it isn't broken, they'll often give you the diagnosis of soft tissue injury. Well, what does that mean? Well, if it's a muscle, you would tend to stretch forward and work on it like that. If it's a disc, you would tend to stretch back, as we've discussed with the McKenzie stuff. You need to know the difference because no one comes back a year later with a cut saying, gosh, this cut's being rather troublesome. But people come back with a sore back years later. They don't know what they're trying to do. So, first of all, it's a disc until proven otherwise. I know that the pain will be in your muscles and it feels like muscle, but truly, mostly it's disc. And if you deal with it like a disc, then I think for the most part, it's going to go well for you. So lots of bending forward, that's how you got the problem. Now you're going to try and do extensions for that level, which we talked about with the Nakumson stuff and the range of movement and how you might do the extensions in lying. So good that it's not broken, but you still need to know what to do. Assume it's a disc until proven otherwise, because for the most part it is. Do extensions, either in standing or lying, or if it's upper back, extensions through your upper back, neck, retraction extension for your neck. Mostly you've been bending forward to get the injury. Mostly it's going back that will treat it. You've got 5 minutes. Now, that isn't time to go to the gym, but you can still do some really useful stuff to look after yourself and to maybe even treat yourself and prevent further trouble. So, these retraction, so you go retract, extend. If you find that tender to do, then you probably need to do it more. So just go at it quietly, but try and get that range back. If it's mid-shoulders, then you can do the retractions of your shoulder blades. And if you're at home, you put the glove on your head and walk around and strengthen those muscles. It will make you feel those postural muscles will start to work and start to engage, and those are the ones you need to strengthen. If you are involved in lifting, you can do those. And some Kegels is the bottom part of your pelvic floor, and then this is the core part here, and then the shoulder blades and the glove on the head. So there's plenty of things you can do to look after yourself, keep your range of movement, and to be strong enough to try and prevent injury. Thank you.